Good day, everyone. We are Group 9, Buendia, Rodriguez, Serrano, and Silao. And today, we'll be talking about diabetes in the Philippines. 1. What is diabetes? How does one develop diabetes? The different kinds of diabetes, the current epidemiology of diabetes in the Philippines, factors attributed to diabetes, which age group is more vulnerable, how do we take care of people with diabetes, does the Philippines have a comprehensive program for diabetes care and treatment for diabetes?
What is diabetes? Diabetes is a condition in which your blood glucose, often known as blood sugar, is abnormally high. It happens when the pancreas stops producing insulin or when the body's insulin is not properly utilized. This leads to the heart, blood vessels, eyes, kidneys, and nerves being severely damaged. How does one develop diabetes? Diabetes occurs when the body is unable to produce or utilize insulin properly. Insulin is a hormone that helps regulate blood glucose levels, and if not enough of it is present, concerns might result. Diabetes can be caused by a variety of causes, including genetics and lifestyle decisions. Type 1 diabetes is caused by the immune system damaging insulin producing cells in the pancreas. Diabetes is caused by the body not producing enough insulin to operate normally. Type 2 diabetes causes are more commonly complex, which means that more than one diabetes cause to take account of. A family history of type 2 diabetes is frequently the most significant factor.
Different kinds of diabetes. There are different types of diabetes. Type 1 diabetes, which has a damage that is permanent where the immune system destroys the insulin-producing beta cells in the pancreas, which cause permanent damage. It is not clear what prompts the attacks, which could be either environmental or genetic. However, lifestyle factors aren't believed to play a role. Type 2, on the other hand, can be from lifestyle factors with the addition from type 1 diabetes, including environmental and genetic factors. There's also prediabetes, which is the stage before type 2 diabetes and basically means that your blood glucose is higher than normal but not high enough to be officially diagnosed with type 2 diabetes. Lastly is gestational diabetes, which can be gotten during pregnancy, especially for people with a family history of diabetes. There's a 50% chance that it may develop into type 2 diabetes. Type 1, type 2, and gestational diabetes are the most known or common types of diabetes. Current epidemiology of diabetes in the Philippines. Based on the information obtained from the Department of Health in the Philippines, diabetes is the sixth leading cause of death, and according to the data from the 2013 Philippine Health Statistics, over 6 million Filipinos are diagnosed with diabetes. DOH, being the country's leading public health government agency, provides free risk screening for diabetes on rural health center or barangay health stations, as well as oral anti-diabetes medicine and education on the prevention of it and its signs, symptoms, or just an overall way of avoiding complications when dealing with it, for it is a familial or lifestyle disease, which makes the risk of it having it quite high. Based on the research estimating direct medical cost of type 2 diabetes, mellitus is in the Philippines a protocol. The prevalence of diabetes, more specifically type 2 diabetes in the Philippines, has increased from 3.4 million in 2010 to 3.7 million in 2017, which made the government formulate strategies upon controlling the increase, which just further proves how important it is to be educated about it.
Factors attributed to diabetes. Genetics play an important role in determining whether we may or may not have possible risk at obtaining diabetes. However, genetics and hereditary alone are not the only factors that contributes to this. One's lifestyle is also related to determining the risk factors. Such factors that can be controlled are considered as modifiable risk factors, and on the other hand, those that cannot be controlled or changed are called non-modifiable factors. Next, please. Next slide. The risk factors differentiates from each other depending on kind of diabetes. Type 1 diabetes usually starts during childhood or adolescence. However, it is also possible to appear at any age. People with type 1 diabetes have increased risk among the following factors. Family history suggests that diabetes can be inherited from our parents or our close family relatives. If we have a blood relative with diabetes, the chance of developing diabetes is increased. Pancreatic diseases result in insulin to be made at a slower pace. On the other hand, autoantibodies are known to be antibodies that attack our own body's tissue or organs. This can result in making errors in our system. Environmental issues such as being exposed to viral illnesses can also affect. It is also shown in the several studies that countries such as Finland and Sweden have a higher rate of type 1 diabetes. Lastly, physical stress pertains to factors like surgery and exposure to illness. Following this are the risk factors of type 2 diabetes. Type 2 diabetes, on the other hand, has insulin resistance factors, which are often caused by the following listed factors. Obesity or being overweight is an important factor that can increase a person's risk of developing diabetes. People who are overweight often develop type 2 diabetes for a reason that a fatty person gets more immune to the cells and insulin. Having impaired glucose tolerance has a strong chance of acquiring type 2 diabetes. On the other hand, insulin resistance makes the pancreas work harder in order to sustain the need insulin the body has to intake for it's larger than people who are not immune to insulin. Studies also found that even though there is not enough evidence to back it up the phenomenon, the statistic shows that Black, Hispanic, American, Indian, and Asian American people are common with diabetes type 2. Women with polycystic ovarian syndrome suffer from hormonal imbalance, thus resulting in increased chance of diabetes. Lastly, age determines that the older you get, the more prone you are to diabetes. However, it is also possible for children and teenagers to have one. Next would be the gestational diabetes, which is developed by pregnant women. Obesity and overweight, glucose tolerance, family, history, ethnic background, and age. These are the following factors that contributes to increasing the great risk of gestational diabetes. Which age group is more vulnerable? Next slide. Just like what is stated in the previous part, age contributes to the factors of acquiring diabetes. However, what is the most vulnerable age group to diabetes? Type 1 diabetes is believed to be more common in children, for it is usually caused by autoimmune reaction. On the other hand, type 2 diabetes is a disease caused by both genes and poor lifestyle. With this, it is used to be called adult onset type of diabetes. However, as the time passes by, the changes are made. It is not becoming common in children as well. During diabetes diagnosis, it is shown that middle age in America ranges from 45 to 64 years old, results in 4% of the population, and those who are about 65 results in having 25% diagnosed of type 2.
How do we take care of people with diabetes? There are varying ways on how to take care of someone who's diabetic. Number one, learn more about diabetes. There are different types of diabetes, and its severity also depends on the age of the patient. By educating ourselves, we can cater to their needs efficiently. Number two, plan healthy meals for a diabetic. A well-balanced diet can be very helpful for reducing weight, which is beneficial while attempting to control blood sugar levels. Number three, exercise together. Offer to be workout partners and meet together a few times a week. Even walking 30 minutes a day will help lower glucose levels. Number four, monitor medication. Oral medicine is generally the first line of defense, and other medications for associated diseases, including cholesterol and high blood pressure, may be added later. Insulin injections may be necessary if oral medicines are ineffective. Assist the person you're caring for with their injections at the appropriate times each day if necessary. Lastly, number 5, be observant to drops in blood sugar. Determine whether the person with diabetes is at risk for low blood sugar, and if so, what the symptoms are and how to manage them. Be aware of these signs and alert authorities if you observe a change in their conduct. This might result in foggy thinking, exhaustion, and weakness. Next. So, does the Philippines have a comprehensive program for diabetes care? Well, as of now, the Department of Health provides free diabetes risk screening at barangay health stations, public hospitals, and government health facilities and an insulin access program. Apart from that, the Health Technology Assessment Council, or HTAC, was established by the Universal Health Care Act of the Philippines of 2019, which mandates the Advisory Council to suggest medications and technology for government funding. Currently, a single insulin analog pen is worth 3 days of minimum wage pay. HTAC is aiming to incorporate insulin analogs in the Philippine formulary to help reduce prices and leverage government discussions. Strengthening primary care units and referral networks is critical as this method develops traction in order to build a robust diabetes care delivery infrastructure. However, it can be argued that these programs are not enough to support the treatment of Filipinos with diabetes, as evidenced in a study conducted by TANG 2015, wherein it was stated that diabetes care in the Philippines is disadvantaged and challenged with respect to resources, government support, and economics. The national insurance system does not cover comprehensive diabetes care in a preventive model, and private insurance companies only offer limited diabetes coverage.
Treatment for diabetes. Diabetes is a serious disease that cannot be treated on its own. Your doctor will assist you in developing a diabetes treatment plan that is appropriate for you. Other healthcare providers on your diabetes treatment team may be required, such as a foot doctor, dietitian, eye doctor, and diabetes specialist. Diabetes treatment entails closely monitoring your blood sugar levels and maintaining them with a range set by your doctor, using a mix of medications, exercise, and nutrition. You can limit or avoid the seesaw effect of rapidly shifting blood sugar levels by paying a lot of attention to what and when you eat. This can require frequent adjustments in medication dosages, particularly insulin. When you have type 1 diabetes, your pancreas stops producing the insulin your body requires to use blood sugar for energy. You will require insulin shots or the usage of a continuous pump. For type 2 diabetes, diet and exercise are good enough to keep the disease under control. Others require medicine, which may include insulin and an oral medication. A balanced diet is essential for diabetics, so create a menu plan with your doctor or a dietitian. For type 1 diabetes, the timing of your insulin dosage is controlled by your activity and diet. When and how much you eat are equally essential as what you eat. Exercise is another essential part of a diabetes treatment plan. Before beginning an exercise regimen, if you have any kind of diabetes, see your doctor. Exercise helps your body use of insulin and may lower blood sugar levels.
And that ends our discussion. Thank you for listening.